So good evening and welcome to the session. So am I audible? Is my slide visible? Please confirm if I'm audible and is my slide visible. Yes, someone is chatting there. Yeah, thank you. Thank you, Jet. Thank you, Salva. Right, Rajini, can't you hear me? Please check with your microphones, dear. Sorry, your earpods. All right. So first of all, yeah, that's good. Thank you, Rajini. So first of all, yeah, great. A big congratulations to all of you who have booked the exam slot. All right. So times have come that where we have to, congratulate one another for getting a booking. Right. So that be as it is. So that's fine for us. Let us move for the slideshow now. Right. Yeah. Welcome, Salma. So congratulations. And let us move on further. Yes, Nihal is coming, Nihal. So, my dear friends, so you would have been under different measures, or some would have done a self-study, you and your study partner. Some may be freshers, some may be repeaters, some would have been preparing for many years together, maybe 2 years, 3 years, 4 years, or even more than that. Okay, so now you're all in one single common pool, right? So what I mean by this is, whatever may be your level of preparation, whatever may be your level of knowledge, I mean to say, there could be a knowledge gap between your part 2 and your part 3, maybe for a few months, maybe a few years. So whatever it is, now you've all come and settle in one single pool. From there, you'll have to launch yourself. All right. So um, I would like you to now focus on these important things that we discussed with you towards the end of the last leg of this particular journey of Massage. Believe me, take it from me that once you get your pass letter, life is going to have a very beautiful new beginning. So what I mean by that is you start experiencing that, maybe in 3 months' time from now on, okay? Hopefully. And best wishes and praise to all of you. So remember, my friends, whenever you sit for the exam, you all have to understand these basic principles. Unless and until you do that, it might be a little challenging. So getting a slot itself is more cumbersome, rather more challenging than the exam itself. So having got a seat itself is something like you are blessed for that. So it's precious. So try to catch this opportunity in hand and finish it in one go. Right. So there should never be any looking back. So focus your mind for that and seek from help from your family, your friends, your colleagues, your hospital or your practice, whichever setup you are in, and try to focus on this exam and clear this in one. So what points that you ought to remember? So I'm sure all of you would have been in your own level of, you would have been, it's just hardly 7 weeks for you to go for the exam, 7 to 7.5 weeks to go for the exams. So at this juncture, it is quite challenging, it is overwhelming, it's overwhelming, as well as it would be, some of you may get so much nervous and panic. So that is a very common occurrence. We are human beings. So don't worry and don't think that why I'm getting nervous or why I'm getting stressed. So all this have to happen to human being. We are not robots, neither we are gods. So we ought to behave like human beings, and we are designed to be designed to in such a way that sometimes we can get nervous, sometimes we can lose our cool, sometimes we get into panic states, right? Sometimes we can forget so many things in that nervousness. All this is what happened to occur. Okay, so understand that and accept that. Okay, so don't keep on having a conflict with that. So travel with all these things in your mind. So points to understand is you are expected to be a safe, a knowledgeable, an empathetic ST5, that is a middle grade doctor with good set of communication skills. So that is what is expected out of you. So ST5 doctor is a middle grade doctor who will seek guidance from the consultant. And he always teaches the junior colleagues and interacts with the junior colleagues. So you're not the junior most, neither you're the senior most. You're somewhere in between, right? So you always have someone up to look and seek for guidance, inform him, bring him the look of care, get in touch with him in cases of things when things go beyond your control, right? And you're obliged to intimate to him or her. He's your boss. Same way, you have a junior colleague, a teaching colleague, an ST3, an ST2, an ST1, whom you have to do a teaching task. You have to communicate with your midwives, your medical team, your nurses, your midwives, your counselors. Okay. And so you're a middle grade doctor, as not only a consultant, but also the specialist, the concerned specialist, the concerned super specialist. So you might be a doctor in your own hospital. You might be having a roaring practice. You might be the top level doctor in your government setup. You might be whatever you are in your current position. That's absolutely fine. But however, for an exam, for this particular exam, remember that you are a middle grade doctor. So you ought to be a safe, a knowledgeable, and empathetic middle grade doctor, ST5 doctor with good set of communication skills. So that is what is expected out of you. And I've written here a common platform as far as this exam is concerned. What I mean by common platform is, as I told you, you might be anything in your current practice, in your current situation, in your real life scenario. However, in the exam, you have a common platform. As I told you in the beginning, you are into the common pool now, whichever level of preparations, how many ever long years you would have prepared, or how much short time you have taken to prepare. So that's absolutely fine. Now we're all in the common platform. Again, some of you might be in the age group of 20 to 30, some may be 30 to 40, some 40 to 50, some 50 and above. You might be having different levels of experience. Some may have 5 years experience, some may have 10, some may have 30, some may have 20. You might be a fresher, just finish your post-graduation. You might be a middle grade doctor, somewhere in 35 to 40 or 45 to 50 in your registrar level. Some might be the top level consultants in your own place, in your own setup, in your own countries. It's absolutely absolutely fine in your real life scenario. But as far as this exam is concerned, you are a middle grade doctor. So you are equivalent to another doctor who's just having 5 years experience. You might have 25 years experience in your pocket, but you're competing with a girl who's just a fresher with just a 5 years experience. Okay. So remember the fact that you're all now in a common platform. All right. So you ought to speak only in these terms. You have to be a safe doctor, a knowledgeable doctor, an empathetic doctor, a middle grade doctor, and you have to have a good set of communication skills. So not only your clinical skills are being examined, your managerial, your leadership, and your teaching skills could be part and parcel of all of your tasks, or at least most of your tasks. It's just not your clinical knowledge that's going to help you clear the exams. So all your applied clinical knowledge is just the 100% of what you did in your part 2. So we have examined you in your part 2. Sorry. Your 100% of knowledge has been examined, and that's why you're sitting here. However, we have extracted just 20% of the 100% that you did for your part 2. All right. So you have to understand this fact. Just with only mere knowledge, you may not be able to pass the exam. However, you can never pass the exam without knowledge. Okay. So as I told you, out of the 5 domains, applied knowledge is just 1/5 of the domain, that is 20% of the domains. So the rest of the other 4 domains, as you're aware of, information gathering, patient safety, applied knowledge, and your communication with the patient and colleagues. So remember the fact, my dear friends, you have to give equal weightage for all these 5 domains for you to clear the exam and score with a higher score. So I will tell you about all those words as I progress in the session today. So yes, so we are going to talk a bit of the content and the methodology, which you are already aware of. A quick revision. So please believe the fact that it's a doable exam. Strategic planning is the need of the hour. You are aware of the syllabus, you're aware of modules, the domains, the SPTs, the SDs, the teaching tasks, the lay examiner tasks. So that's just a fast revision. So these are the domains that you are already aware of. The weightage of this course, mark distribution, simulated patient tasks, and the structured discussions. I'm teaching no props for the onliners. For the face-to-face, definitely you'll have a prop exam. So believe me, my friends, this is a totally interactive exam. Okay, this is not an interview. This is not a lecture. This is not a Viva voice. Remember, it's a totally interactive exam. So for the online exam quiz, it's 2 minutes and 30 seconds. For the face-to-face quiz, it's going to be 2 minutes, preparation time, and 10 minutes performance time. So I call this as a performance. I don't say this is attending an exam or attending an Viva voice. It's a performance. All right. So as you're aware, the online exam goers will have 12 at the end of 7 tasks, we'll have a 12 minutes break, and not so in the case of a face-to-face exam as of now. But maybe there could be something which might come in between and which might, extend a helping hand for you. So we are yet to hear from the Royal College. Is there any improvement, or is it just going to be the same pre-COVID days face-to-face exam? We have yet to know. Right. So for the onliners, I'm telling the Osler exam goers, please keep everything, your systems, your internet connection, your mic, your earphones, headphones, whatever you're using, try to keep them pakka so that you do not have to redo the tasks, right? So redoing the tasks might be more challenging than than the original tasks. So that shouldn't put you in trouble, all right? So please take care of all these things. Hopefully the nature also helps, but something out of the way happens which are not of your control. Definitely the college is going to help you. Say, for example, in the last time in 2020, when there were a lot of floods in Chennai, so candidates who took the online exam from Chennai had their own difficulties. The Royal College came with beautiful, support, and they were given some reruns, and all that do happen because there were heavy floods and thunders, and a lot of internet disturbances, even with the highest speed. However, this time we don't expect such things to happen, but anything out of your control, like for example, if there's a plane which is going above, there's a bird which is chirping outside, this one far away heard telephone bell, it's not going to bother you, and they also do understand that this is out of your control. However, you'll have to keep your environment soundproof, and towards as we progress towards, we'll be meeting, very often for the free sessions, as well as for so many other interactive sessions that we offer for the November candidates, for my course candidates, for my one-to-one candidates, for more candidates, for all the other general guests also, right? So towards the exam, you'll be having special sessions separately for the face-to-face exam goers, preferably an open camera session, as well as for the online exam goers as well. Okay, so don't worry, we are here to do our very best to you, and yeah. One line take-home message for the day is: please allow the role player and the examiners to talk. So what I mean by this is, it's, as I told you in the beginning, it's a totally interactive exam where you will have to answer ask certain things, then they'll be answering. However, it's not the same all the time. So there is some time where you will have to allow them to talk. Just like how you and me are professional, doctors, they are professional actors, role players. All right. So they have the script to talk. They have their scenario to play, the emotions to display, the dialogues to speak. All right. So you might be seeing a recall task. All right. So which you could have practiced with your study partner 200 times. You could have studied under so many mentors, under so many courses, under so many mocks. So whatever is there. However, if you don't allow them to talk, you will not be in a position to help the examiner evaluate you. So what I mean by this is, just like how you got your own templates running in your mind, they have their own set of questions to be asked. So believe me, that's where the whole thing lies. That's where you have to really wake up and then say, okay, this task, there might be something new. Yes, always keep yourself in a fresh mind and an open-minded approach. All your templates, all your preparations, all your materials, all your courses, all your mentors' trainings, and including me, all right? So this has to be at the back of the mind. However, in the forefront, you need to have that freshness in approaching a task. You could have done 10,000 cesarean sections in the whole of your career by this time, maybe. Some of you would have crossed 5,000, some of you 2,000. We never, like, it depends on each one's experience. However, tomorrow morning, if I call you for a cesarean section, don't you think that you still need to have an approach, fresh-minded approach? Every human being is unique, isn't that? So intraoperatively, we face across so many things, isn't that? The same old cesarean section that we have been doing for years together might be challenging for tomorrow. We never know. Unless and until we are careful, we are safe, then we might land up, or we might, put up a difficult situation where we might have to face a difficult situation, which might risk the patient's life. So to avoid that, aren't we careful? Aren't we sure enough that we have a good sleep? Aren't we sure enough that we had a breakfast before starting, or at least a cup of coffee? Isn't that? Don't we take such precautions before we do the 10,001 cesarean, the first cesarean section? Isn't that? Yes, the same amount of meticulousness and open-mindedness and freshness is important in approaching the task. Just never take any task for granted. So that's where, unfortunately, things go wrong, right? So each and every task in this 14 task circuit demands and deserves to be respected that way. The same amount of meticulousness and care and fresh-minded approach has to be there when you do the task. And just like how, as I told you, they are doctors, they are actors, they have their own questions to be asked. So you might be thinking, oh, this is an active practice, and I've answered all the questions that the role player will ask me, just like how my mentor taught, just like how the madam where the group where I took the the mock exam taught, just like what the PIL says. But still, you could have missed a couple of questions that is supposed to be asked. That is there in the role play script. And if you don't have time to, or you do not allow her to ask, your task will go for a borderline. Take home message for the day. Allow the role players and the examiners to talk. What I mean by, so I've given you an example of allowing the role player to talk. So let me tell what is meant by allowing the examiners to talk. So you might wonder what ma'am is meaning by allowing the examiners to talk. Of course, they are the ones to question us, and what is the point of me allowing them to talk? Yes. When the examiner is asking you some questions, please attend attentively. Please listen to them attentively. Because it's a structured discussion. It's a 10 minutes, 10 minutes task, and you definitely have a lot of time. So don't worry about structured discussions, except the labor ward tasks, which are challenging. But however, we'll be having at least 2 or 3 labor ward free sessions before you sit for your exam. Okay, so we'll be calling you every now and then, and we will be having sessions with you guys, right? Just a moment, girls. Excuse me. Right. So, however, suppose if the examiner is asking, could you tell me the antenatal management of this patient? Please talk to the antenatal management. Unfortunately, in the stress of the exam, you might tend to miss what the examiner is asking for. Okay, so please be clear and crisp and up to the point. So don't try to show whatever you've studied in your guideline, whatever you studied in your talk, whatever you've read in your patient information leaflet in the task. No, we are not examining you that. Please remember that. Please listen to whatever is being asked to you and answer accordingly. He is asking you to tell only the antenatal management. Please stop with the antenatal management, because that is the, you will be evaluated only for that. I can see some candidates, when we ask the antenatal management, they will finish antenatal, intrapartum, postpartum, contraception, and preconceptional counseling for the next pregnancy. And then they will be asking, they'll be keeping quiet after that. Unfortunately, my dear friends, you have to realize this fact that even if you speak the whole lot of whatever is there in your mind, in your memories, you will be taken, you'll be valued only for whatever the antenatal management that you've spoken. However, the next question could be, could you tell me the intrapartum management? You'll be exhausted by the time, because you might think, oh, I have already told why I should repeat again. Or you might say, for example, if there are 10 points, you might just skip a couple of points, so which might make that particular answer score lesser. Okay? So please listen attentively to what the examiner is asking you. If you do not understand, maybe because of problems with the earphones or because of the face-to-face exam, if you're not able to understand their slang, it's absolutely fine. This is not an English exam, all right? So they will not worry even if your English is not like a British English. No, we are not examining you for the exam. I mean, the English exam. However, if you still have any doubts, please ask. Doctor or sir, so could you please, rephrase the sentence for me? Could you please repeat the sentence, the question for me? So they'll be more than happy to do that for you. If you don't ask, and if you're going to just think that, oh, maybe if I ask, the examiner will think otherwise, the examiner might mark me down, or the examiner might think that I'm very stupid. Please don't have your own inhibitions. Please ask them very clearly. So could you please rephrase the sentence for me? Could you please repeat the question for me? All right. So instead of misunderstanding some question and saying a wrong answer and losing the task, that is worth asking this question. Could you please rephrase or repeat this task? Repeat the question for me. Okay. So please be smart in communications. So allow the role players and the examiners to talk. So that's the take-home message for today. 2 minutes and 30 seconds loading time for the onliners. And for everyone else, it's going to be 2 minutes to read and to take notes. So when there's a 10 minutes task, please aim for 9 minutes. The simulated patient task, do your agenda fixing. In 50 to 55 seconds, information gathering, including your history, examination, investigation, 3 to 3.5 minutes, apply clinical knowledge, 4 to 4.5 minutes. And please give the last 1 minute for the role play to raise the questions. More the role play task, you will get. More the role play is going to talk, more the marks you will gain. Great. Right. So I've written here the applied clinical knowledge. The applied knowledge is the customized, tailor-made knowledge. So what I mean by this is, we don't want whatever you have done in your PIL or whatever you've done in your guidelines and your talks and your materials, all right? So we want you to speak what that particular station is demanding from you or what the role player is asking. Not whole of your guideline. Your guidelines is 86 pages. We cannot check you in the 4 minutes of all the 86 pages knowledge. So please don't. All right. So it's a customized, tailor-made knowledge for that particular station or as the role player asks. So you will be able to understand this particular sentence statement in detail as we progress further on. The structured discussions, please use S-bar tool whenever it's required. So that's their communication tool to the situation, background, assessment, and recommendation. And please remember, my friends, this is an exam of justification. You ought to justify the examiner and the role player of what you are telling. You just cannot say, I want to do this for you. I want to just make you lie down and examine you in the front of the chaperone. I will do this. You should justify why you're doing. You can never touch a patient without justifying why you want to touch her. All right? I want to do an examination to look for any pathological mass or bladder. I want to just examine how the baby is doing. I want to listen to the baby's heartbeat. I want to have a look at the down below for seeing all these things. I want to do an internal examination for finding out. I want to send you for a couple of tests, which includes the blood test, to check your blood counts. I want to check your, your scan. I want to check for the baby's well-being, and all that stuff has to be part of your task. So nothing will be valid if you don't justify. And the justification has to be evidence-based. That evidence is going to be your guidelines and detox and the RCBG recommended guidelines, the NICE guidelines, and the BASH and every other thing. Here in structured discussions, time is never a problem. Please allow the examiner to talk and ask you questions. Okay, you cannot just rush things. You can just ask, rephrase certain things. They will always give you time to find out if, like for example, at the end, sometimes they might ask you, do you have anything to say? Do you have any information, any other answer, or they can ask you, is there anything else that you want to say for any of the questions asked about? As I told you, it's going to be a totally interactive exam, so don't ever get scared. Never get scared, never get afraid. Suppose for question number 1, if you ought to say some, let us say for example 10 points, out of that you have somehow forgotten the last 2 points. You could travel the 8 points through and you forgot, and you went on the next question that was asked. Finally, in the end, if you remember. So I would like to just add these 2 informations or these 2 sentences for the question number 1, which is asked. They'll absolutely accept that. They will not reject it. As long as you are in a cool, calm, composed mind to remember and to speak those points, will be definitely taken into account, and that will be scored. All right, so please remember, allow the examiner to ask questions, interact with the examiner, justify whatever you are saying. This is an exam of justification. Unless and until you justify, that will not be a good performance. Right. So this is what we say for structured discussions now. So labor ward prioritizations, we are yet to know, because a lot of things about labor wards coming up, but hopefully the last UK exam, they had 18 tasks, 18 rooms and 20 rooms. But thankfully for the face-to-face, the girls who attended in Chennai and other overseas centers as global candidates, as online exam goers, the hostlers, they had only 9 or 10 tasks. That was a beautiful thing. However, you never know. Right? So let us be prepared. So I always say to all the candidates, all is fair in love and war and MRCOG. All right. So it's a war footing. It's a war footing. You are lucky enough and you're blessed enough to acquire a seat for yourself, a slot for yourself. So you have to make this a very successful attempt. Not just a mere success, it should be a success with high scores. Right, so regarding the labor ward, it's maybe 1 to sometimes even some room with 1 to 1.5 minutes for a room, sometimes less than 30 seconds. The any ward is 1 to 1.5 minutes per room. We can spend, we're having 4 to 5 tasks. I mean, 5 rooms, nothing more than that in the gynae ward. You're aware of the syllabus, the books, all these things. It is just, you are aware of all these things, all these books and the recollections from 7 to 22. Your pills, RCBG, NHS, NHS condition strategy videos, exam key videos, case-based discussions in the strategy, summaries of the guidance and algorithms, prompt manual, embrace reports, last 3-year talks. So what is the action plan for November 22, my dear friends? Yes, we have some courses and mocks. We'll be discussing about that. All right. This is a feedback from our February batch mock candidates. This is a feedback from our course candidates and our mock candidates for the batch 3 exam goers. Yes, we had Soumya Agrawal with us, who scored 80. We had Munawar, who scored 76. We have Wafa, who's first time exam goer, and she scored with a very high score. She just had, she was just a one-to-one candidate with me, an Egyptian girl, and she cleared the first attempt in spite of the fasting prayer, the holy month of Ramadan. She really put a very hard work so she could clear in the first attempt. And she had her exams. She cleared a part in January. She came to me in March. She did the exam in May, and she got the Royal College membership in June. So that was a very beautiful journey in practice with Wafa. We had Sumaira, who was from the UK, and she scored. Yeah, welcome. I'm very happy for you, Dr. Manikam. I would.
Thank you, ma'am.
One of my elite candidates. Yeah, I'm very happy for you. I was sincerely praying for you. So actually, I was praying for each and every one of you.
Thank you so much, ma'am. Because of that only, I got it.
So thank you so much, and wish you all the best. And now keep the keep the fire in you. And
Yes,
now that is going to be, going to flower in a very beautiful way. I'm very happy for you, Dr. Manika.
Thank you.
Right. So together we can, it's a teamwork. So it's going to be you win, I win. So your win is my win and my win is your win. So we have a crash course, which will be starting in the next week, the 6 weeks crash course. And what we'll be doing is we'll be giving you practice stations, just only 5 candidates per batch, individual feedback, once a week session. Sometimes we can call you more than that because my candidates know I always give them more than what I say. All right, so I say them 6 sessions, but I'll give them land up at 9 sessions. So I will make an announcement in the group. Come on, we'll have a talk, we'll have a get together. I mean, a sort of my get together is like this, not the other way around. So we'll have an interaction. Dr. Manikan is well aware of all this, isn't that, Dr. Manikan? Yes. Yes, Nihal. Yeah, thank you so much. Yeah, Nihal is there with me, and Nihal knows. So you'll be given individual special attention. That's why it's a small group, only 5 members per, only 1 batch and only 5 members we are going to recruit. And already 1 batch is running, so that's absolutely fine. We are just have to, because of the request, we are opening another batch, and we are here, and I'll be announcing the date in the group. In the next week, we'll be starting a crash course for 6 weeks. Right, we have mocks, which we start from September 18th onwards. We have 2 set of circuits and 14 tasks in a circuit. So 28 and 2 circuits, 28 different tasks, which will be exam-oriented, exam-based tasks, right? And I've got a very great surprise for you guys in the month of October. I'll let you know from there. I don't want to break the suspense here. I'll personally call you, Dr. Manikam, to inform about that later.
Ma'am?
I'll personally call you over the big surprise before I announce the group. Okay, I'll call you before that.
Okay, ma'am.
Yeah, that's great. Thank you. So we have we are starting on September 18th, the mock exam. So it's up to you to book. So Sumaira, when Soumya came with me for first mock in the beginning, and towards the exam, she took the second mock with me. Same way, Munawar took first mock with me the middle of April, and the second mock was towards our exam. All right. So we have something specific, very special for only SmartMed, the first ever time that we are giving intensive 1 live intensive hour every day, at least 6 days a week, in a specific time in OTD, which is going to suit for the global candidates from whichever part of the world we are in. You'll be able to communicate with me over the call, and we will be having 1 live intensive hour. All right, so we will be giving a small sample of that by tomorrow, and you'll be knowing what I mean by the smart hour. We'll be giving intensive coaching for that. It's not a sort of a task that you're going to give and someone is watching and I'm going to give the feedback. It is not that way. That's going to be a totally different thing. And it will be the thing that you really need at this moment. All right. So that will be presented to you. And so any of you interested in all these things or any one of these things can communicate with me directly or with the moderator. So what you will be doing at this point of time, you need at this minimum 1 study partner, 2 to 3 will be the best. Split your study timing into 2 or 3 sessions per day, 1 in the morning, 1 in the afternoon or night, or in the afternoon or evening, and 1 at night. So no human being can sit and do this sort of a practice for 6 hours or 5 hours together, which is humanly impossible. You might be exhausted, and when your mind is not fresh, you cannot do this performances, this preparation. So please split your study timing into 2 or 3 sessions per day, 1 in the morning, 1 in the afternoon or evening, 1 at night. Morning slot, you can do the recall tasks. The afternoon slot, you can do some book stations. And the nights, we can do random stations from your courses, from your whichever course you're in, or whichever you're either under, are you under me or anyone of the fellow mentors. I respect all my fellow mentors, my fellow colleagues who are helping you, each and every one of the colleague, of the fellow mentors of mine, from any other group. You say a group and have a friend there. So all these courses, all these mentors are shining stars in your path of Mrcog. They are shining their light upon you and to help you travel in this grand path of Mrcog to make you a member of the Royal College of Obstetricians and Gynecologists. So I respect all my fellow mentors and colleagues. With that respect in my heart, I ought to say that whichever course you have undergone, whatever materials you have, whichever course you're currently undergoing, you've already undergone, or you're with me, or you're planning to join me, whatever may it be, it's your choice. But please do the practice accordingly, which will make you successful. So you will score not only with mere pass, but with high scores. So remember to do in the morning slot some recall tasks. It's again your choice, individually your choice, whichever you want to do, but please try to make all these. So that's why in the November pre-exam group, I'm giving you some recall tasks. In my common group, I'm giving you some book tasks. And in between, I'm also calling you for some random tasks, and I'll give you something from the talk. So I'm also keeping you well engaged in whatever I'm saying. All right. So I'm not just going to give you, say use things and wash my hands, because I have a course for part 1, part 2, part 3, and we have a great post Mrcog and GMC registration, UK jobs, NHS jobs, Australian jobs, and Singapore jobs, and then whichever country or whichever council, medical council you belong to, you can still get guidance from us. So me and my colleagues are here, especially me. I'll be able to guide you through and through. Once you get to your Mrcog, you can join that group and you'll be guided thoroughly till your GMC, till whatever you want to become. We will be able to guide you directly. I'll be able to do most of the things. Still, if not, I can always get my friends to get in touch with you in the group, and they'll be able to guide you. All right. So this is a great journey, and we are all fellow colleagues in this great family of SmartNet. Right, so always do a video call of the practice and do video presentations with the timer on, and please record them and video recording. So you will be able to self-judge yourself and self-apprise yourself of how you can improve on this. Please arrange leave at least 3 weeks before the exam. Arrange everything with your job, your home, your family, and your kids. That is the need of the hour place. Remember, we are in a war field. We are in the war footing. But please never get panic or nervous. You're being guided by the higher up, whether you're a believer or a non-believer. No, we don't talk about such things here. It's up to you. You can be a believer or you can be a non-believer. Whether you call it as God, whether you call it as nature, or whether you call it whatever definition you want to say. You're being guided and you're blessed to book your exam slot. So now it's in your hands and your responsibility to take this a successful completion, a successful performance. All right. So feel empowered, feel confident, and feel that you will be able to do. So never allow nervousness, panic, or any sort of negative emotions to override you, because it's quite common. And it is it's human nature to behave that way. I know the candidates at the helm of affairs towards the exam, even a small drop of a pen might make them, lose their sleep. And people are I've seen the worst forms of racist things. Even if a child cries, they might get angry. At the drop of a pen, they might get irritated. So such things do happen. Yes, let us accept that. We are human beings. We are neither robots, we are, as well as we are not gods, right? So we can behave as human beings. However, we still can manage to empower ourselves, be confident, and stand in this war. You are on the war footing, and I'm there with you through and through. We are there with you in this market through and through with us. All right. So please arrange leave at least 3 weeks before the exam. Arrange everything with the job and the home and the family and the kids, and keep yourself definite study hours for your exam. All right. So any doubt so far? Are we good to go for the tasks for the day? Are we good to go for the tasks for the day? All right. So I would like to have Zobia with me. Zobia, can you please open your mics?
Yes, ma'am.
Great. Right. So are you good for the task number 1?
Okay.
So can you see the task, please? By the way, Zobia, you're an online examiner or face-to-face exam?
Online one.
All right. Okay. Let me focus the timer for that. So can you see my 2 minutes timer, Zobia?
Yes, I can see.
Right. So can you see the task, please?
Yes, I can see the task as well.
Start your 2 minutes now. Sorry, my dear, you need extra time.
No, it's okay.
All right.
I've gone through it.
Yeah.
Okay.
Right. So let us start with the task now. Please start.
Hello, I'm Dr. Zubia, one of the doctor in the Urogyne clinic today. May I confirm your name and age, please?
I'm Gabby Simpson, 36.
How may I call you?
Yeah, please call me Gabby.
Okay, Gabby, I gathered from your GP letter that you have some waterworks problem. and you are here to discuss about the management options. Am I right?
Well, that's right, doctor.
So, Gabby, is it okay if I ask you a few questions to know your condition better, and then we'll come to a safe and mutually agreeable management plan for you?
Yeah, that's right.
So, Gabby, can you tell me more about your problem?
Oh, well, doctor, it started around 8 months before. There was some sort of burning when I was peeing, as well as some lower tummy pain. I went to my GP. The GP did some tests, and she told that there are bugs in the urine. And I was given antibiotics, after which the burning sensation got down. But however, the lower tummy pain still persisted. And from then on, I had to, again, gone back to the GP a couple of times, but nothing seem to improve. I've taken a lot of painkillers, over-the-counter medications also, including the brufen and the paracetamol, but nothing seemed to work out. Doctor, the worst part of this is, I'm a very busy accountant in a multinational company, and I feel so embarrassed to take very often toilet breaks. This pain is the one which is driving me to the toilet.
Okay, I'm sorry, Gabby, that you are going through a lot. Can you tell me that, what is the duration of the exactly the pain is?
You mean the duration of the pain?
Yes, yes.
See, doctor, I am being driven to the toilet because of the pain, but once I wee, the pain is coming down, and it's almost nothing when I come out of the toilet. However, after some time, maybe 2 or 3 hours, or whenever I feel that I have to go to the toilet, I'm being remembered of this pain.
Mm-hmm. Okay, and can you tell me about your drinking habits?
Beg your pardon?
Can you tell me about your drinking habits, like how many times you take fluid intake, caffeine?
I take, 6 to 7 cups of coffee and maybe 3 to 4 glasses of cola. And, I'm a very busy professional doctor, so I don't have time to, I eat my food properly. Most of the time I take food from outside, so many outside foods. I don't have time to make a cook for myself.
Mm-hmm. Okay, and have you noticed any food that is causing this pain, that is increasing this pain?
What sort of a food, doctor?
Like any spicy food?
I love to eat spicy food, but I have really not correlated that with the pain. Is that so?
Mm-hmm. Okay, and as you mentioned that when you empty the bladder, it's relief, pain is relief, right?
Yeah, that's right.
Yeah, and so how many times do you need to go to empty your bladder for during the day as well as the night time?
Maybe 6 to 7 times in the day, and once or twice at the most at night.
And do you get to the pee on time?
Yeah, of course.
Mm-hmm. Any experience any blood in urine? Any
No,
in the pee? No.
no,
Okay. Okay. And do you wet yourself while during the certain activities like laughing and coughing?
no,
Do you feel any bulge from down below?
no.
Okay. Few personal questions, Gabby. Are you sexually active?
Yes, doctor, I have a partner, my husband. Yes, doctor. Yes, Zobia, where are you? Zobia? Girls, can you hear Zobia? Can you hear me? Please open your mics.
Yeah, we can hear you, ma'am.
Okay, so
Yes,
can
we
you
can hear you.
Yeah, thank you. Where's Zobia? Zobia, can you hear me? Zobia, I can see your mic is open, but you're not speaking, my dear. I'm pausing your time. Zobia, are you there? Girls, can you hear Zobia?
No, we can't hear her, ma'am.
Yeah, even I cannot hear her. I think some internet issue or some shit. Her mic is closed now.
Hello? Hello? Can
Yes,
you hear me now?
Zobia. Yes, where are you?
Yeah, I think there was some connectivity issue.
No
I'm
worries,
sorry.
no worries. I paused your time. Please continue from wherever you left.
Yeah. So, Gabby, can you tell me a few personal questions, Gabby? Can I ask you?
Yeah, please.
Are you sexually active?
Yes, doctor. I have a partner, my husband.
And do you feel any discomfort or pain or leak while having sex?
Nothing.
Okay. And have you ever been pregnant before?
Yes, doctor. I have two kids, 3 years old and 5 years old. Both were born by normal deliveries. I'm planning for one more, but before that, I need to just get settled with this.
Okay. And can you take me through your periods? How is the period?
Yeah, my periods are regular, doctor. My last menstrual period was just 2 weeks before.
Okay. And are you using any form of contraception?
Contraceptions, nothing at the moment.
Okay. Are your smears up to date and fine?
Yes.
And do you have any medical condition for which you are following your GP?
Nothing, doctor.
Okay. And like as just mentioned that your BMI is 27, is it right?
Yeah, that's right.
Okay, Gabby, thanks for sharing the information. I would like to explain you that the from the history and the that examination that was done, that is the condition you have is the bladder pain syndrome. Have you heard of it?
What's that, doctor?
Gabby, this is a condition in which there is defect in the like it's basically the lining of the bladder that's get irritated due to the some harmful substance that is present in the pee, and it weakens the tissue and cause this pain.
Oh, really?
Am I? Yes.
Okay, doctor.
Okay, Gabby, do you want me to explain the management options that is available for this?
Yes, please.
Yes, Gabby, there are some certain lifestyle measures that is done, that is the relief of the stress, and sometimes some certain dietary modifications might be needed that to cut down the coffee, and certain spicy foods if you are taking, then that helps in relieving the symptoms of this. Am I clear so far?
Okay.
And apart from that lifestyle measure, there are certain drugs that is we call the amitriptyline and cimetidine, and that relieves the symptoms of this bladder pain syndrome. And
Okay.
this is basically the stepwise management plan of this condition. And if one is not effective, we'll go to the another one. And there are expert team of doctors, including the pain management team and the special in the urogynecologist, that is a doctor specialized in this area, will be there to help you and support you and deal with the management. Okay.
Okay.
And if these medications are not effective, do you want me to carry on with the other management options?
Yes, please.
Yeah, so there are the methods like we are going to give certain injections into the bladder that is given, and for that you would be told to taught you the intermittent catheterization, like you will be able to catheterize yourself because there are certain side effects that the B get obstructed after that injections in the bladder. Okay. And there are certain nerves that can be there is nerve pathway that is stimulated, which we call the sacral nerve stimulation, that can be done. This is one of the option, and the if not effective at all, then we have surgical options as well, and which are like we look in via telescope through into your bladder and do certain measures, like certain treatments in the uh, bladder that will be effective in that case. This is the last resort part.
Okay, doctor.
Okay. So, Gabby, do you want to ask anything?
Doctor, when do you think I will be all right?
Gabby, the exact time cannot be certainly said, because we are going to treat you in a stepwise manner. One, if not affected, then we'll go to the second management option. But we and me and my team are here to support you and help you throughout the journey. And the first of all, I will give you this lifestyle measures and will connect you with the this support group that can help you as well. Okay.
Okay, doctor.
And I will also advise you that as your weight to height ratio is a bit higher on the higher side, that you will cut down the weight as well due to by exercise and other measures. Okay.
Okay.
Okay, these are the patient information leaflets that I'm going to give you. You can read through them and you can come back to me whenever you feel any query or any doubt. Okay.
Sure, doctor, I'll do that.
Yeah, and I will fix an appointment with my consultant to have a detailed discussion on this, if you want.
Okay, doctor.
Okay, Gabby, I'll be writing back to your GP about this discussion with your permission. Okay.
Okay, doctor.
Okay. Thank you for your time, Gabby.
Thank you, doctor.
Thank you.
Thank you, Neha. Thank you, Zobia. Good start. So tell me, Zobia, how you did?
Not good, ma'am, I think.
Do a
Well,
self-apprisal.
obviously, yeah, I need a lot of practice, obviously, I know.
Okay. Do you think you missed something? Do you feel that you missed something?
Mm,
Right.
uh,
So this is a case of, yeah. So a good start, Zobia. You got a very clear, audible, understandable English, and you speak fluently with adequate pauses. So you are able to interact with the role player in the language that you're expected. And you have a grasp of knowledge about the bladder pain syndrome. All right. And you were able to remember the steps of the treatment, and you were offering her in stepwise manner. You were able to communicate with her, and you were able to check her understanding. However, a few things have to be improved on. Your interaction, bladder pain syndrome is a diagnosis of exclusion. A safe doctor is the one who's going to communicate, having differential diagnosis in his or her mind. Unless and until you're going to be sure of that, that might make you an unsafe doctor, or that might pull down your applied knowledge, right? So whatever may be the task, you should always have an approach towards the differential diagnosis, and you have to ask very specific questions. I was happy when you asked about the fluids and this food, and I asked what food. Then you told spicy food. Why can't you say that? Are you in the habit of taking any spicy food? So don't you think that's a waste of time? Yes.
Yeah.
So be clear, be precise, be specific, and up to the point. So we don't want unnecessary talking, unnecessary words. So we want you to speak all the buzzwords, which is important for the task. Okay. So this is one of the things that, if you can remember at the beginning, I was telling about customized, tailor-made knowledge. Okay. So for a SUI or a prolapse, you may not ask a question of spicy food. It's not necessarily there. But for a BPS, for a bladder pain syndrome, you ought to ask that question. And if you don't ask, so that a couple of things, if you don't ask, then that might put your information gathering as borderline. Unfortunately, students tend to miss the important points that they have to ask, the important point or the asterisk points or the star value points or whatever you call it as in your own terminology. Those buzzwords, if you don't ask them, for example, if you take a case of a molar pregnancy, and if you forget to ask about cervical screening for a 25-year-old girl, about 25-year-old, then you might go for the information gathering might be a borderline. However, if you ask in the nervousness of the exam for a 21-year-old girl about cervical screening, your information gathering will definitely go for a borderline because you lack appropriate situational awareness. You all know that cervical screening is only after the age of 25. So what is the point of asking a cervical screening for a 21-year-old girl? It's ridiculous. But unfortunately, if your brains are not being tuned that way, you carry on saying with the same old template which is stuck to your mind. So please don't do that. So we want customized, tailor-made knowledge for that particular task or what the role player is demanding. Right. So don't you think smoking is an important idea?
Yes, it is.
Yes. Here, the role player's instructions were that she was a smoker and she smoked around 25 cigarettes per day.
Okay.
Yes, because you tend to overlook sometimes. I'm not telling you. You doesn't mean Zobia. So you means it includes everyone or most of them. I don't mean anyone to point my fingers personally. No, I'm not that way. But I'm just trying to say the candidate in general. They might tend to overlook. Oh, yes, what is there in this? It's just it's mushkila. This is just a bladder pain syndrome. I'm just going to do that with these. But unfortunately, if you miss some buzzwords, some important things that you speak, that you ought to speak, you might go for a borderline. And that's why the candidates do not know where they miss the task. Well, so don't you think she's got a pain, a bladder pain syndrome? This is a diagnosis of exclusion. So you have to ask so many negative questions. I mean, you have to get so many negative answers by asking her so many questions that you finally arrive at this diagnosis. Isn't that so, Ria? So don't you think differential diagnosis is an important aspect of approaching the station? Don't you think endometriosis is a differential diagnosis? Don't you think chronic pelvic pain is an differential diagnosis for this task? So if you had the differential diagnosis in that mind, naturally questions will fall that way. An element of abuse or violence could also be a part or a cause for her pain. Did you ask the mental health status? Did you ask or not?
No, I
You didn't ask. Because you thought, okay, this is just a plain straightforward bladder pain and why I should ask. Unfortunately, if you don't ask, your information gathering will go for a borderline. So in the information gathering, if 3 or 4 points you're going to miss, then how would you expect the examiner to give you 2 or 1? He may not give you everything. So that's why people will come out and say, ma'am, this is all recalls, ma'am. But unfortunately, they will lose 3 or 4 points, 3 or 4 marks, or even 5 marks, or even anything less than that, or just 1 single mark. All right. So never take any task for granted. Never take any, especially a recall task for a granted, which you can never afford to do that. As I told you in the beginning, I'm not sure whether you joined in the beginning, just the 10,001 cesarean section that you're going to do tomorrow, because you would have done till today 10,000 cesarean sections. Even then, for the next task, for the next operation tomorrow, you need to stand there in the OT with that fresh mind and open-mindedness, because every human body is unique. You might come across something new, something aberrant, some aberrant vessel which is running. You never know. Just like that, don't you think it's important for you to have an approach to the task? As I told in the beginning, this task you could have practiced 200 times with your study partner and with so many mentors and courses and free sessions and mocks and whatnot under the sun that you are doing for this preparation for the Mrcog final exam. However, how could you miss that? Don't you think that is important, my dear?
Yes, it's important, ma'am.
Yes. So a safe doctor is a one who's going to have the differential diagnosis in his or her mind. That should be proven to the examiner by way of asking questions, the way in which you interact with the role player, the way you discuss your management options, right? Not just your patient information leaflet that you've studied, not just your clinical guidelines, or the RCOG or the NICE guidelines that you studied. So this is what the example that I'm giving for a customized tailored knowledge. So here, so introduction, confirmation of purpose, agenda fixing, concerns and expectations. The details, please explore her concerns. You know what was my concern? You never explored my concern before you fix the agenda. Somehow I had to bring in that I'm planning for the 3rd pregnancy. That I volunteered that. But in the exam, they may not give you. And if you're not going to address my concerns, your consultation is going to be useless for me. Because I'm sitting with that pain for the past 8 months. I can still prolong with another 2 months. I'm a top class busy professional. I have 2 kids already. I'm planning for the 3rd one. So my concern was I have to get settled with this pain before I go for my next pregnancy. That was my concern. Unless and until you explore, you ask me, I will not tell you. You got the
Mhm.
point?
Yes, yes, definitely. Yeah, thank you.
So always explore her concerns and expectations before you fix the agenda. The peasant compliance. So remember, my friends, you and the role player, as far as this exam, I mean, we are speaking only things pertaining to the exam and not the other way, right? Not nothing else. Your time is precious. My time is also more precious. So I don't want to waste each other's timing by talking unwanted things. So whatever we speak is going to be totally towards the exam. So remember, you're interacting with the role player. A role player is a fellow human being like you. So you have to, whichever part of the world you've been practicing so far, or you are practicing currently, whatever may be your style of practice, that's absolutely respectable. However, for the exam, you ought to think that you are interacting with a fellow human being who's just in front of you, but you have to interact with her in that language that she understands, not your medical language. So that's why we said no medical jargons, right? So you are interacting with a fellow human being just like you. It's a shared discussion. It's a shared management option. It's not something like that where you will decide, you will tell her to do. That's not RCOG. Unfortunately, many candidates do fail because I totally respect whatever practices you've been doing in your own places, in your own setup. That's absolutely fine. But for this exam, please remember that it's an RCOG exam. This is a shared discussion. It's not an interview where you ask questions and she'll answer. It's not that where you sit in your consultation room, you say to your patient, okay, I'm going to do this for you, I'm going to do this for you. And she's going to nod her head. No, this is the place where you are going to interact with a fellow human being. You have the added qualification as a doctor, and you're going to use all your medical language, all your medical knowledge, and speak to her in her language, not your language. Please understand that, okay? And then you are here to convey her the information that is needed, the diagnosis that has been made by you with all your investigations, with the information gathering, with all the reports in your hand, with all the evidence-based knowledge that is there in your brains. And you have to communicate with her in her language. You are going to give the information based upon this. She will make the informed decisions. You're not the one who's going to decide for her. Remember, please. It might be a little bit of challenging and a bit of unlearning the same old practice which you have done for the past 10 years or 15 years or 20 years or whatever may be your level of experience and practice. However, with the RCOG, remember that you ought to speak in a patient-friendly language. It's a shared discussion. It's a shared management plan. You are sitting there to tell all your medical language, in medical knowledge, the patient-friendly language, the layman language, and finally, she's the one to decide what does she want. You're here to discuss all the options, management options, offer her, recommend her. Then she'll be the one to decide what she wants and what was her decision. Remember, whatever is her decision, you and your team, your consultant, your colleagues, your team, you are there to help and support her, nothing else. All right. So I can totally understand that might be a little challenging, especially in the panic of the exam. But my dear friends, that is what is expected out of you to clear this exam. Please unlearn certain things and relearn certain things for you to achieve success in this exam. Unfortunately, I have come across so many of the fellow colleagues who got very good road in practice, excellent teachers in their own medical colleges, excellent communicators in their own mother language as well as in English, excellent doctors in their own field, excellent surgeons. However, they do fail at the exam. You know why? Because their practice is not the way that may not be the way that has been expected out for this exam. So unlearning and relearning is the most challenging thing that is in front of you. Unless and until you're going to unlearn certain things and relearn certain things, the exam might be most challenging. However, if you're going to fit into that, into that slot, you're going to have a very smooth sail in the exam. Believe me, take my words. All right. So two things you have to remember. how you speak and what you speak. There's a lot of difference between how you speak and what you speak. Again, we're not going to conduct you the English exam. So in the GMC, we'll be called for me. We used to attend, GMC webinars. We ought to attend as GMC holders that every now and then the GMC calls us to a webinar. And the other day, we were taught about the usage of must and should for 45 minutes. One another day, we had to discuss about will and shall. So there were so many things. There were good practice points. There was a discussion, right? So what I was trying to say is, things are so meticulous. Please focus. Okay. Never take any task for granted. Never try to do any task casually. I'm not telling that you should immediately become too much conscious, too much attentive, and too much, nervous. No. I mean to say that you ought to think each and every task as important, give its weightage, because that is the one which is going to make your pass, isn't that? So each and every task in the exam, in the circuit, is important. So coming back to the feedback. So introduction, confirmation of purpose, agenda fixing. Before you fix the agenda, explore her concerns and expectations. Start with the history of presenting illness. So the presenting illness is the one which is going to differentiate you from the rest of the other 13 candidates in the exam. So a safe doctor is the one who's going to have the differential diagnosis in the mind when you start giving the presenting compliance itself. So the details of the pain related to intercourse or periods or bowel habits. So that will tell you whether she's got any abuse, any endometriosis, any other non-gynec causes for the pain. Whatever the duration, the onset, the aggravating factors, the relieving factors, whether she is relieved by passing urine, frequency, urgency, leak, any voiding disturbances, any dribbling, any treatment taken so far, whether it's affecting the bowel habits, and is it affecting her intimate life, and whether is it affecting the quality of life that she already told you. The gynec history includes the LMP, the painful PDX, smears, and contraceptions. Obstetric history is the routine ones that she asked. And medical history, always remember obstetric history is the past and the future. In a gynec case, the past, present, and the future in an obstetric case, obstetric task. Medical history, whether she's involved with the GP for any medical conditions of a child, of that, or she's talking any medications at present or in the past, any allergies, any surgical history, and especially we don't care about spinal surgeries and neurosurgeries and ophthalmic surgeries. We care only about surgery of the pelvis or down below or the tummy. Family history of concern, social history of smoking, alcohol, drugs, and occupation, and ask how far she's feeling supported at home. Rule out domestic violence, ask a mental health status, which is very important. Rule out sexual abuse, very, very important. After signposting, BMI, yes, it's already given here. Yes, yeah, it's good that you confirm. So the differential diagnosis could be a chronic pelvic pain and endometriosis and sexual abuse, to name a few. Applied knowledge, yes. Bladder pain syndrome is a poorly understood bladder condition that causes long-term pelvic pain and problems while peeing, which is usually treated by pads and urine. It's because of the defect in the lining of the bladder. It could be because of some allergy causes or faulty immune system. Lifestyle modifications, yes, you have to avoid spicy food and alcohol and smoking if at all that is there. Planned toilet breaks. She can go for bladder training, controlled fluid intake, reduce the stress, do some pelvic floor muscle exercises, support from the family and friends. She can take some medications to start with paracetamol or codeine and cimetidine. And if it is still not okay, then she can go for some stronger medications like amitriptyline, which is going to produce some happy chemicals in the brain. And still, if she's not all right, she'll be referred to the pain management team where she'll be given, she'll be put in touch with a clinical psychologist who's going to give her talking therapy. If it's not all right, then she'll be taken care of with the multidisciplinary team of doctors, including the urologist. There'll be some intravesical procedures like introduce the camera, and which might, introduce the stress. Voice is not clear. No, slides will be later. So we are just giving the feedback. Intravesical, introduce the camera, overstretching sometimes to inject some injections, some chemicals to heal, to numb, like lignocaine or chondroitin sulfate heparin. Nerve stimulation, nerve at the ankle, at the back, which are stimulated electrically. Camera test and filling. water, just to look for the inner lining if at all if there's an ulcer. A tissue sampling will be taken and she'll be treated for that. She's given patient information leaflet and support group. Okay, just and arrange for a counseling session for her. So that should be your completion of the task. Okay. So here you come across a super educated, super class professional who's going to talk overconfidently. You still have to manage that patient. You can have on the other side, you can have a crying patient who's get very tearful, postpartum depression woman, or you can have to break a bad news. Okay, so all these scenarios you'll have to perform, right? So please to work towards scoring all your domains as a pass Zobia, and so that you can make this as a successful task. So any doubts, Zobia?
No, ma'am. Thank you. It was wonderful feedback. I will definitely work on it.
Yeah, that's great.
I
Thank
missed
you.
a lot of.
No worries. You can still have time to practice, but do start practicing as a war footing, right? All the best. So any other
Thank you.
colleagues, any other friends, any doubts, I will go for the next task, please. That's and no other doubts, I can proceed on with the next task. All right. So can I have Salma with me? Salma?
Yes.
All right. Are you good for this task? Please take you 2 minutes.
Yeah.
Salma, by the way, you are appearing for the face-to-face in the UK, right?
Sorry.
Are you going for the face-to-face exam in the UK?
Yes. Yes. Yes.
All right. Then I will close your timer.
Okay.
Right. So please take, I'll have my own timer, but the timer will not be shown to you. But you can hear the buzzer, right? That's the only thing that we can give you. So take you 2 minutes. Your 2 minutes are starting now.
Okay. Thank you.
There are 2 slides in this, my dear.
Yes. Next, please. Next, please.
That's it. There are 2.
This only. No more.
1 and 2.
Okay. Okay. First one, please. There is a OSET form.
No, there's no specific set form.
Okay. First one, please.
Yes, your time is up.
Hello. I'm Salma, ST5, and you are?
Hi, I'm Rose, SC2.
Mm-hmm. How are you, Rose?
Yeah, I'm good. Thank you.
Yeah. Yeah. How is your training going on?
Well, I really love to work in the department and everything has been really fantastic. I've been in the department for more than 3 months and all my friends and colleagues and my seniors are very helpful.
Mhm. Rose, if you have any problem, don't hesitate to contact with me. We are here to help and support you. Okay, Rose?
Oh, thank you, Salma. That's great to hear from you.
Thank you. So, Rose, I can see that you have done that evaluative repair and you came here today for that you want to sign off for the OSET form. Am I right?
That's right.
Mhm. Do you have any other concern that you want to discuss today?
This OSATs procedure I did yesterday, the episiotomy, and my senior is the one to sign it for me. Before that, she got an emergency call and she left, and then I was just expecting for her today, but unfortunately, she's taken a leave for some personal reasons. So could you please, Salma, could you please sign this OSAT for me? Because I want to, finish this OSAT and get myself for an ARCP, which is pending for me for this year.
Sure, Rose, we'll discuss about that, okay, about the OSET form, and for sign off also, I'll discuss. But before that, is it okay that we'll discuss about the episiotomy, how you have written, and then the recommendation for OSET sign, yeah, that what the requirement for that. So we'll discuss about that, and then at the end we'll give feedback each other, and I'll give some materials also if needed. How does it sound?
Well, that sounds great.
Mhm. So is it written this episiotomy that you have done?
Yeah, this is what the assessment which is given, I believe.
So can you tell me that do you feel any difficulty while you are doing the episiotomy?
No, absolutely not.
Yeah, I can see that, that your OSET form is written that, yeah, you have written the document nicely, and also bleeding you check, and not tied properly. Okay. So only I'm concerned about one things that, that episiotomy, it is not identified. Yeah. Yeah, and also no rectal examination before and
هلا
after.
بالزين، كيفكم؟ طيبين؟ اخباركم بخير؟
Hello.
الدنيا عندكم طيبه؟ الله يديك العافيه ان شاء
Do you
الله.
think
كلكم
do you
كويسين؟
think that it
الله
is
يسلمك يا رب.
important
الله يسلمك.
to identify the episiotomy?
Yeah, sometimes.
Do you know that what complication can arise if we cannot find out the episiotomy apex?
No, I don't. I think I did the procedure perfectly.
Yeah, some background knowledge. Nice. Yeah. So actually, yes, there is a risk that there could be blood hematoma formation. There could be severe bleeding. Patient even though may go shock, okay, due to severe bleeding, yeah, due to hematoma. So this is patient safety.
Okay.
Yeah. So patient can complain about that. Patient can come in life-threatening condition even. Yeah. So this is
Okay.
more. What do you think that it is important to identify, isn't it? Yeah,
Yes, sir.
Rose.
Okay.
Yeah,
Okay.
and also that to do the rectal examination before and after episiotomy. So it is most important, because if there is any rectal injury or anything that third degree perineal tear, also normal episiotomy, we do this rectal examination. Yeah, so before that, that means why you are doing this rectal examination, because that to see there is any injury to the rectal mucosa. Yeah.
Okay.
Okay. Yeah. So this is that's why important to do. And so what do you think about that? It is important, isn't it?
Okay.
Yeah. Yeah. So as it is patient safety, okay, so that's why that we need to that you did under the under supervision of another doctor, isn't it? Yeah, yesterday. Yeah. So
Yeah, it was actually supervised by my senior.
yeah, so senior, so that I wasn't there. So it is important that who will give you sign, it should be under supervision of her. Okay, that means, and also there is some concern that about the patient safety, that if that apex is not identified and there is a no rectal examination. So this is the requirement for the that summative set. Am I
Okay.
clear? Am I clear? Yeah.
Okay.
Yeah. So is it the first time that you have done this under supervision, or you observe also before?
I've observed so many times. However, this is the first ever time that I'm doing my own self.
Yeah. So Uset, so if you want, that I can arrange for you another appointment that you can do under supervision of me, then I can see that how you are doing, and you can do yourself also whatever you like. Then I can see that you have done this apex identify, and also the rectal examination you have done or not. Then I can sign for you, which is requirement for the OSET sign off. What do you think, Rose?
Mm, yeah. Okay.
Yes. Yeah, and that for the OSET there is a need 3 sign. One should be with consultant, and another 2 your senior like ST6 or ST7, they can sign for you. Yeah, so even though you need another 2 sign. Okay.
Okay.
Yeah. So what do you think? Do you have any question?
Um, yeah. I don't have any questions.
Huh? Do you have any question?
No, I don't have any questions.
So do you have any idea about the OSAT? Can you tell me that what I told you, that how many signature need? Can you tell me?
Yes, I can tell you that OSATs is the one which is essential for.
Hello? Hello?
Hello, can you hear me? Sorry, my mic was
Yes,
muted.
yes. Yeah,
Right.
there is
So
interruption.
OSATs is the one which is going to help you, to judge candidates' performance, which is important for the annual appraisal.
Yeah, this is objective skill assessment test. Okay, so that means the how many sign you need. Can you tell me?
Yeah, that's I believe it's 3 signs.
Yeah, 3 sign, and 1 including the consultant. Okay, and can you tell me that what you need to improve that in the
But
episiotomy
doctor,
while
could you
you
please sign for me? Dr. Salma, could you please sign this OSAT for me so that from the next task onwards, I'll be the one to do.
Yes, I can write here that that towards the competency, I can make it tick mark that towards the competency where it is written. That means you need to again to do this episiotomy under my supervision or any consultant. Then we can sign for you that yes, you are competent enough. Then I can sign for you. But now I can write here that towards the competency. Am I clear?
Okay.
Yeah. Okay. So it is, do you have any
Yeah,
question?
time up, time up.
Yeah.
No, Salma.
No, actually it is patient safety. Even though if I'll give you that, yes, sign for you, so you think that, that it is patient safety, that you need to do properly, yeah, that to identify the apex and also the rectal examination. So when I see that, yeah, you can do competently under my supervision, then I can sign for you, because otherwise, we cannot compromise the patient safety. Am I clear?
Yes, doctor. Yes, Salma.
Yeah. So I'll give you that some materials about the episiotomy. You can go through, yeah, the guideline, and also that about the OSET, some materials about that. You can go through that. What is the requirement and everything? Then you can understand that it is important for the patient safety. Yeah. Okay.
That's
Do you
okay.
have any question?
No,
So how's the session, Rose?
the session was good.
Yeah. So thank you for your time. So tomorrow I have the duty on delivery suite. If you like, you can come and you can do issue to me if there is any patient available. Then you can do under my supervision. Then I'll give you the sign for you. What do you think?
Okay,
Yeah. Thank you.
thank you. Salma, whatever we speak after the 10th minute, my dear, will not be evaluated. Okay, so please try to do within the time, especially you're going to. So whatever is going to speak after the 10th minute is never going to be evaluated, especially you are sitting in a face-to-face exam, so you'll have to, go to the next chamber immediately after, just the moment you hear the buzzer, you stop and get up and go to the next chamber, in front of the next chamber where your instructions will be posted, all right? So please try to finish whatever you want to say within the 10 minutes, okay? Salma, my dear, yes, you were, you know the task, you were able to communicate with your junior colleague in a clear, audible, understanding language. However, you undermined me and you became unsafe by signing my OSATs, even without observing my performance. Do you think we can do such things? How can you just say with someone else's assessment? This was the assessment which was given by the senior colleague who supervised this Rose episiotomy yesterday. So can we just do such things? Do you think it can be a safe doctor? By signing your OSAT? Yes, come on, Salma, please answer my question. Salma, please, could you open your mic? Salma is not there.
Sorry, it is not clear. Can you repeat, please?
Salma, do you think you're a safe doctor by signing her OSATs without even observing her doing the task, doing the episiotomy?
No, that's why I explained that I wasn't yesterday. There is another doctor.
Even then, you don't have any business to touch her OSAT form, isn't that, my dear? Did she do that in front of you? Did she signpost to you before doing the procedure that you have to sign the OSATs? Did she perform her episiotomy in front of you?
No.
Then how?
Yeah, that's why I told her that you didn't, do under my supervision. So it needs to be done by my supervision. Then I can sign for you.
You told me that I'll be writing as working towards competence, isn't that?
But I don't know, this towards competence is before some mentor they told that this
No, Salma, listen. Be very clear in the concepts. Be very clear.
Yeah.
Number one, if someone is wanting you to assign or to put the signature for the OSATs, she has to signpost you that she's going to do this particular task, and you have to give a summative OSAT or a formative OSAT, all right? And then she will be performing, and then you will be assessing, and then you will be able to give the assessment, whether it's a formative or summative, as per her signposting. And you can never escalate a formative OSAT to a summative, even if the formative goes very well, without your interference or without your help. She's going to do excellently. Still, you cannot take it as a summative. Neither you can downgrade a summative OSAT just because it didn't go well. You cannot downgrade that to a formative one. And please, if you have not seen her performing the episiotomy, you can never sign the OSAT. Or never say working towards competence or whatever you want to write, please. Okay?
I don't
Give
know.
me this
This is
point.
maybe
Yeah,
misunderstood.
please take this from me. Please take this from me. Okay. This is the most common. This is one of the commonest tasks that exams are frequently repeated tasks. But unfortunately, if someone is not aware of this fact, they might tend to close. You totally become an unsafe doctor. So where's your patient safety? You are telling the apex is not identified, patient safety is gone. If no PR, no patient safety. Yes. So what if you are going to sign and do you think that you're a safe doctor by signing someone else instead of someone else? You can politely refuse. You can directly and honestly say that, I'm sorry, Rose, I haven't seen you performing those acts. I'm sorry, performing the episiotomy, and I'm in no way to sign those acts. However, I'm here to help you. So since we have discussed about those acts, the episiotomy, again, I will be able to call you in a day or two. And whenever we get a episiotomy, you can perform the episiotomy in front of me, and I'll be able to observe that and then give the OSACs. Will that be okay? Yes. So tell that in a very polite and a polite way. You'll have to refuse in signing the OSAC. If you agree to sign, that's it. The task is gone.
Can I interrupt, Doctor?
Yes, please. Yes, please.
Can I interrupt here?
Yes.
Thank you. So I don't know, before we had session for this. So what we learned that, that there is a two line. One is towards the competence, another one is competent.
Dr.
So
Salma,
in this
I
case,
totally get your point.
Yeah, I'm just asking you. Okay.
Yeah.
So if there is a mistake that you issue to me, so what we learned that we can sign that towards the competence. So towards the competence means that she need to learn and she need to supervise under me. Then I can sign for her competence, which one is the second line written that yes, she is competent. Second line I can trick after the checking the competency.
Dr. Salma, Dr. Salma, when you asked me for the OSAT form, I said there's no OSAT form here. Didn't I tell you in the 2 minutes reading time? You asked me, is there any OSAT form? I said there's no specific OSAT form. So what does that mean? So this is what I said. This task, you could have studied under so many mentors, under so many things, but everything has got a small change and you have to pick up the niche, you have to pick up the cue. There's no OSAT, then where do you want to sign? You have not observed, then how can you sign? Have you observed? Is there anything which states that you have observed? She's sitting in front of you with this assessment, and you are here to. Is there anything mentioned here? This is where things go wrong. This is where, this is what I was trying to say. You sit with a preconceived idea. You sit there with a preconceived notion. Oh, this OSAT task, this episiotomy, teaching a junior colleague, I have done 150 times. I know this thoroughly. And you go on and on and on and on and on, and you bombard with informations. Unfortunately, you miss the most important thing. Is there any word mentioned here that she did the performance, or did the role play tell you that she did it in front of you? What did she tell you? She told that she did the task yesterday. It was observed by the senior colleague, and she left because she had an emergency call, and the senior colleague didn't turn up today, so that's why I've landed up with you. Isn't that a statement? Yes or no?
Yes.
So this is what we say: customized, tailor-made knowledge, not what and all you know about the episiotomy and the teaching and those acts. So be clear, be crisp, be precise, have a fresh and open-minded approach. Maybe if you have listened to, if you have read your instructions properly, if you have listened to the role play properly, clearly, then you wouldn't have committed this mistake because you had done the same task with some other mentor, some other course. That could have been a different thing. So this is what, again, my dears, which is happening in the exam. Someone who took the exam way back in 2021, in the May or November or in the February, and who is going to repeat it. Unfortunately, they still get stuck to that particular task, which they did. And they think that, oh, the same task came in the last exam, so the role player is going to ask me the same questions, the same tasks. So they tend to be casual, they tend to overlook, they tend to lose the task. So I give you an example in the beginning and somewhere in the middle also. You do 10,000 cesarean sections. Tomorrow you're being called for the 10,001 cesarean section. Still, you need to have that fresh mindedness and open-mindedness in opening up that patient, isn't that?
Yeah.
You just cannot take that the woman in the operator, the surgery table tomorrow. You cannot take her for granted. You will have that freshness and open-mindedness when you open up, isn't that? Because you have to be prepared for any surprises in a human body. Every human body is unique. The same approach has to be there when you approach this task, my dear Salma. Unless and until you're going to have that. You means, I don't personally mean you. I don't personally mean Salma or anyone. It's personally the candidate. The candidate is going to have an open-minded and a fresh approach. Unfortunately, the task may not fall good. You may not expect the result that you wanted out of this task. This task may go as a failure and a borderline. Unfortunately, this has gone for a failure because you are an unsafe doctor by saying that you will sign towards competency. How can you judge her without even seeing her performance? Is there anything to state that? Yes, my dear Salma? Are you able to feel the difference?
Yeah. So
yes, please, that's what I said. Please unlearn and relearn. Very difficult, very difficult. But this is the need of the hour. Because you really have to open up your brains. You just cannot take any task for granted. As I told you, each and every task in this 14 task circuit demands or deserves to be treated in that way. And not your mediocre, traditional, by-hearting and memorizing way of doing the task. I'm sorry to say this, but you have to improvise on yourself. I mean you means not only Salma or anyone else. It's a candidate. Yeah, my dears. So this is what we'll be doing. We'll be offering you when you come to for the smart hours. For this one, when I was telling you this smart hours, this is what we'll be offering you, because you will be intensely grilled. You'll be intensely grilled of how you will have a fresh approach and an open-mindedness when you sit for the task, and that with the specific time constraints, your brains will build naturally. You'll open up, and that's how all my top-class scorers of my May batch and February batch topped up. Soumya Agrawal and Sumaira and Munawar and Dineshwari. There were a couple of mentors from the other groups, from the fellow course mentors also, and they were very happily, studying under me, even being mentors for the other group, and they could really come up with very good scores. I'm happy and proud to say that, because yes, we give you that intense training. So see, Salma, this is such an easy task. I'm sure that you have practiced at least 20 times, isn't that? Yes, Salma?
Yeah, I think so. We are in wrong way.
Yes,
we are in wrong way. What I know that, that if I'll not observe her, if it is another doctor, so we can trick towards the competence, and if I supervise them, then I can. If it is competent, then I can write the competent, the tick mark. What I know. So thank you to correct.
Yes, yes. Please open up. Please open up. Learn new things and unlearn certain things and relearn certain things. Okay, my dear. So this is what I said: customized, tailor-made knowledge for that particular task and what the role player demands. Okay, not what you and me studied in the patient information leaflet. The patient does not know guidelines. The patient does not know patient information leaflet. She is a fellow human being sitting in front of you, sitting with her own set of questions, and you'll have to answer them, right? The patient does not know literature. The patient does not know guidelines, and even in your clinics, isn't that, my dear? Yes.
Yeah.
And second, very, very important thing, that is, you were sounding a bit too paternalistic, saying that you have to do that, you have to do that way. So please do some appropriate change in the tone of your voice and voice modulations to make this a successful task. Otherwise, your communication with the colleague will go as a borderline. It will not be a failing thing, but it will go as a borderline.
Okay.
Yeah. So you ought to be very polite, very gentle in pointing out their mistakes. At the same time, you'll be giving a supportive hand to help them come out of the mistakes and learn in a better way. And together you'll be in this learning journey. Yeah. And never
Thank
forget to give us some educational resources. Your applied knowledge was good. You were able to crack the task. It's not something new. It's not a challenging task. The approach is very important. Yes, you have to open up, and you just can never take a D task for granted, my dear. Take it from me. Suppose if I'm going to the exam today, and tomorrow, Salma, you're coming. So you're my friend. So tonight I'll call you up. Salma, ask me these questions, these tasks and all came. So tomorrow you're going to see the same task, this question. Oh, this is what she told me yesterday. She said, so I'm going to get the same questions. Unfortunately, it may not be. So there you will get stuck. You will get fumbled. You will get nervous. You tend to blabber some things. Please don't. All your background knowledge, all your preparations, all your materials, all your templates, all your hard work, which is done so far, so many months or weeks or years, that should be in the back of your mind, in the forefront. Your freshness, your open-mindedness, your presence of mind, your active listening is going to help you as equally as to what is there in the back of your mind. Okay?
Yeah.
Hope I'm clear with this.
Yeah. Thank you very much.
Thank you, Salma, for this great presentation. I love to interact with you and the further more sessions. Thank you so much. I need Dr. Prasanna. Are you there? Can you do a task here, my dear? Dr. Prasanna, can you open up and do a task, my dear? Dr. Prasanna, I think, is busy. All right, no worries. Can I have Mavia Osman? Can I have Dr. Mavia Osman? Could you please unmute yourself? Girls, am I audible or am I speaking to myself? Please, one of you open up your mics.
No, you are audible.
Okay, thank you, Zobia. Thank you, darling. Right, so I think Mavia's Osman is busy. Can I ask Sneha Mishra to open up the mic, please? Girls, please volunteer yourself. Right, so let me throw it to the house. Please, one of you open up your mic to present the task. Shaista?
Yes, ma'am.
Who's that?
Yes, ma'am.
Yeah, Shaista, are you going to do this task?
I will try, ma'am.
Yeah, right. So you're going for an online exam, my dear, or is it going for a face-to-face?
Actually, ma'am, I'm waiting for the response because I was waiting for global seat. So they
Okay.
didn't, yeah, so all seats already booked. So I mailed them. So hopefully, inshallah, let's see
Inshallah.
what is the response.
Inshallah, no worries. All right, no worries. So please do this task, my dear. All right, so you are opting for a global seat, isn't that?
Yes, ma'am, I'm waiting for global.
All right, so let me focus your timer here. So can you see the task, my dear? Can you see the 2 minutes timer, please?
Yeah, ma'am.
Great. Right, so please take the 2 minutes in
Can I
preparation.
start?
Yeah, take your 2 minutes.
Okay. After 2 minutes.
Of course.
Ma'am, task is not visible, only timer is visible.
Oh, I'm sorry. Really? Could have told me previously. Wait.
Yes, ma'am, but I already read this. No worries.
Sorry, are you able to see the screen or not?
The tasks I have seen before. Now the time is coming only.
Can you see now?
Yes, ma'am. Now it's visible.
Right, okay. Let me restart your time, please. I'm sorry for that. If you want, I can give you the 2 minutes.
It's okay, ma'am. No worries. I can start.
You can start. All right.
Yeah.
You can see. Okay, please let me start your 10 minutes now. Your 10 minutes is here.
Hi, I'm Dr. Shaista, one of the doctors in antenatal clinic today. May I confirm your name and age, please?
I'm Rebecca John. I'm 27.
How can I address you?
Call me Rebecca.
Ravika, I have gathered from your case notes that you are 16 weeks pregnant and you want to discuss your management option. Am I right?
That's right, doctor.
Yeah, sure. In next few minutes, I will inquire about some questions and finally we can reach to self-acceptable and mutually agreed management plan. Would that be okay?
That's great, doctor.
So how has the pregnancy been so far, Ravika?
Doctor, I'm 16 weeks pregnant, and this is the first time that I'm coming to the hospital. And yeah.
Okay, is this your first pregnancy?
Yeah, you're right.
All right, is this your planned pregnancy?
Yeah, that's right.
All right, and just want to make sure, did you take folic acid and is everything going fine? Your blood and scan reports, everything is okay?
Doctor, this is the first ever time that I'm coming to the hospital.
Okay, so this is your first visit. This is your booking visit. Am I right?
Yeah, that's right.
All right. So Rabika, just want to make sure, do you have any bleeding, pain or vomiting, anything which is weird for you?
Well, doctor, you're right. That was like sometime before, but not now.
All right. I can see you are on, from your notes, I have assumed that you are on wheelchair. Am I right?
Yes.
So can you tell me more about your condition? How are you coping after this situation?
Yes, doctor, I have a supportive partner and family, and that's helping me.
So do you know what kind of surgery you had at 5 years of age?
That was like something for my back.
Do you know the exact type of lesion and site of surgery? Did your mom told you about that?
What lesion, doctor? I don't understand.
What site of spinal injury means? Do you know?
My mother told that I have this condition called spina bifida.
All right. So what about your sensation? Are you able to feel the things and are you able to move around a little bit?
I'm in the wheelchair, doctor, but I'm trying to still do whatever is being, recommended by the physiotherapist.
Okay, I can see you are going through a tough time, but don't worry, me and my team of doctors are here to help you out in this situation, Rabika. And what about your bowel habits and opening your waterworks? Do you have catheter for that or diapers?
What is the doctor? Catheter? What does it mean?
Any rubber tube inside your?
Sometimes, yes, you're right. Sometimes I have to use the rubber tube to relieve myself.
All right. Any ulcers or any contractures?
Sorry, doctor, I don't get what you're trying to say.
Do you have any soreness because you are sitting in a wheelchair for a longer period?
Yes, doctor. Sometimes I'm getting, yeah, you're right.
Are you taking on any treatment apart from physiotherapy for this problem?
I was taking, doctor, some medications, but now since the past couple of years, I'm not taking anything. That was just given to, to prevent the sort of cramps that it would get in my lower legs. But now I don't.
All right. So have you started folic acid, high dose?
What is that high dose, doctor?
5 mg, this folic acid. Have you started it or not?
That was actually, given by my GP.
Okay, so don't worry, I will check your notes and see the dose of folic acid because high dose is recommended for you. And you are currently 16 weeks, so I will send some blood tests and a scan report as well for you. So you told me this is your first pregnancy, and what about your periods? Were they regular before?
Yeah, that's right.
Mhm. So when was your last menstrual period?
That was, I think, approximately 16 weeks before. I don't remember the date.
All right, no worries. And were you on any contraceptives before that?
I was taking, my partner was using condoms, doctor.
All right. So do you follow your GP for any reason apart from your physiotherapy and the neurology problem?
No,
Mhm. Any surgery apart from this big bone surgery in your tummy or down below?
no,
All right. Are you allergic to anything, Rebecca?
no,
Any family history of concern or same problem in your family?
no,
Mhm. Okay. So do you smoke or use alcohol?
no, I don't.
Pardon me for asking recreational drugs.
No, doctor.
All right. Your blood group, Rabika, are you aware of that?
I think it's O positive.
Any reservations related to blood transfusion?
No,
Okay, all right. What do you do for living, Rabika?
yeah, I just, I'm doing online trading.
Okay, that's good. And how is the support at home?
Yeah, my partner's very supportive.
All right. Thank you very much for the information. I just want to make sure, I want to know about your weight and height ratio.
I think 32, 32.
Have you ever worked on it, Rabika? I know this is difficult for you.
Beg your pardon?
I can see this is your weight is at higher side. So have you ever worked on it? Your weight and height ratio is 36.
The doctor, you're seeing me in the wheelchair, and how can you just ask me to do any difficult exercises?
Okay, no worries. We have some dietitians and some physiotherapy specialists. Even you are on wheelchair, we will guide you how to cope up with this. And anyways, in pregnancy, weight reduction is not recommended, but at least we can guide you about balanced diet and healthy weight. No worries, Rabika. Thank you
Okay.
very much for the information. Would you like to add anything else?
No, doctor.
Okay, thank you very much. Rabika, I can see you are alone today. Would you like someone to be with you?
It's okay, doctor. Tell me.
Okay, so Rabika, this is your first visit, so and this is your first pregnancy, and definitely it will be challenging. And I can see you are a fighter. You are a real fighter, and I'm going to send some investigations related to your baby, like ultrasound and some blood tests to check your blood strength and other investigations, which are baseline investigations. As you are 16 weeks, so I will check that you had started your folic acid or not. Otherwise, we will recommend folic acid 5 mg, that is high dose, and you have to take it continuously. We will do your down screening and the detailed scanning of the baby at around 20 weeks. And in your case, as this is your first baby and you have a condition, you had a surgical treatment of spina bifida. So you will feel the fetal movements a bit late, or maybe you will not feel the fetal movements. It depends upon the site of lesion. Are you with me so far? Do you have any concern so far?
Doctor, will this condition affect my baby also? Will my baby also have spina bifida?
It depends because if you are on folic acid and I can see your weight is at higher level, and for that I will refer you to genetician and he will guide you further about this condition. The risk is I think less than 1 out of 100 women for this condition.
Can you do some tests for me to just confirm if the baby is having spina bifida?
Yeah, for this, you can have a detailed scan. We will check, and there are some needle tests as well, in which we sometimes we check before that. In needle test, sometimes we check the one amine fructosamine. If it is high, it means the baby has some neural tube defects. But for that, I will ask my consultant and we will decide for this test together. Are you with me so far?
All right.
All right. And it around after 20 weeks, it around 24 to 28 weeks, we will do your sugar screening, because this BMI and with this condition, there is a high risk of high blood sugar. So may I know, is there any family history of diabetes, Rabika?
No, doctor.
All right. So at around 34 weeks, you will be at around 34 weeks, you will be seen by baby doctor, and he will decide you about pain relief during labor, and we will decide your plan of delivery at that time. And we will give you, if everything is going well with your baby and there are no complications, and throughout your pregnancy, we will check the need for blood thinning agents. And at around 36 weeks, we will decide. And if everything is okay with you and your baby, we'll give you a trial of normal vaginal delivery. Are you with me? Any concern so far?
No, doctor.
All right. And at the time of delivery, as this is a high risk pregnancy, so your delivery and even your pregnancy would be managed in a consultant-led unit. We will provide you one-to-one care, and we will give you special medicines at that time, and we will keep a watch on your blood pressure. And sometimes there is a risk of high blood pressure during delivery. So we will give you a medicine at that time if there is a risk of high blood pressure. And we will give you adequate pain relief at that time, and give you some medicines to prevent you from heavy bleeding. We will arrange the specialized prompts for the baby and specialized couches for you at the time of delivery. And after delivery, your baby would be seen by baby doctor, and we will provide you enough support. We will assess the need for blood thinning agents and help you in appropriate contraceptives. And moreover, we will provide you physiotherapists throughout your pregnancy and even after delivery. The physiotherapist would be with you.
Okay, doctor.
And there is also a risk of urinary tract infections. So we will give you prophylactic antibiotics for that in your pregnancy.
Okay.
Okay. Any concern so far?
No, doctor.
I'm going to fix your next appointment with my consultant, and meanwhile arranging your scan and sending some blood tests. And I see you soon.
Okay, doctor. See.
Thank you very much. These are some information leaflets. You can go through them, and these are a number of support groups as well.
Sure, doctor. Thank you.
I missed name. I didn't tell about impact of heavy weight on mother and the baby. I forgot that.
What else did you forget?
I think I was missing something. I was not sure how to detect spina bifida in pregnancy.
All right. So tell me, my dear Shaista, this is the first time that you're doing this task, or have you done that before?
I did it before long ago, but I didn't repeat this.
No,
but I think this is mainly this task is mainly dependent on high BMI. So I have to guide the patient that in that high BMI there is a risk of.
I think you're confusing between Charcot, Mare's and spina bifida, right?
Yes, ma'am. But
no worries. Right. So it's high time that you do some serious preparations, my dear Shaista. Right. A good start, however, that's the empathy. You're seeing a patient in a wheelchair. So a patient sitting in a wheelchair, you don't go to her and say, I can see that you're sitting in a wheelchair. How are you coping with? That might sound a little unpolite and unempathetic, isn't that? Instead, you can start with it. Instead of mentioning, say, for a blind person, we don't go near them and say you're blind. So that might be really offensive, isn't that?
Yeah, this is my mistake. Yes.
So that will no, don't worry. It's not a mistake, but it's a learning period. So we'll be learning together. Don't worry about that. So I always encourage my friends, please take it from me. I always encourage whoever does tasks with me, who is under my mentorship, to do the maximum number of mistakes. Let them be the trivialest and the silliest mistakes. I'm happy to correct that for you so that you will remember this and you will never do the mistake in the exam. But if you are keeping yourself restricted, don't take the chance to present the task in front of the house. And if you don't take the privilege of making the mistakes in the study platform, then you might make this mistake in the exam and you might lose the task. So please be very, very, very open as a outside the task. I'm a totally friendly person. You can approach me anytime regarding any concerns for the exam. However, when it comes to giving feedbacks, I'm a very strict, critical mentor. Even minutest points, I will note down and tell it, right? So I will give a very critical feedback. Please don't feel offended. So suppose if I'm blind and you're going to come and say, I can see that you're blind. How are you coping up with? So
No,
how
it's very
will
wrong.
I feel? As if you're insulting me, isn't that?
Yes, ma'am.
Instead, you can ask, so how are you doing today? How are you coping up with? Do you have enough support at home? Isn't that a good way of saying? Isn't that the communication? Yes? Yeah. And you're noting that she's a prime woman and she has come at 16 weeks. So isn't that your responsibility to explore the reason for her delay in booking? How can you just ask her, how are your tests, how are your scans? Because she told you in the beginning that she's coming for the very first time in the pregnancy. So always explore her reason for the delay. Is there an element of domestic violence? Is there any lack of support? That is so. Then you'll have to offer her social support. That's your responsibility. Yeah.
Yes, ma'am.
So here is the place that we act as not just as a clinician, as a leader, as a manager. Yes.
Yes, ma'am. You're right.
Yes. So it's in the outset. So my dear friends, the first 2 minutes of the task and the last 30 seconds are the maximum attention span that you will gain from the examiner. So the first 2 minutes, you have to be really careful in what you speak. So that's why we say, sit with a fresh mind, a fresh approach, common sense, the presence of mind, and whatever you're going to speak. Because that is the maximum attention span that they're going to spend on you. Of course, they'll be attentive throughout the 10 minutes, but the maximum attention span, the first 2 minutes, and the last 30 seconds, how you close the task. Okay, if you're going to make some grave mistakes, that is going to say to the examiner that the rest of the 8 minutes is not going to be, that good. Yes?
Yes, ma'am.
So in the beginning, if you're going to that means you have not actively listened to what the role play says. This is what we say, customized, tailor-made knowledge. You just go, this is Vanas Mana Bafida. Okay, what is there to talk? You tend to overlook. You tend to be casual, and unfortunately, even knowing the task, you might tend to go as a borderline or not answer the task. All right. So please be some intense preparation, my dear Sahista. And coming to the answers per se. So introduction, confirmation of purpose, and agenda tracing. Did you ever bother to explore my concerns and expectations, my dear? Don't you think that is important before fixing up the agenda? See, my concern was my baby was affected or not. And if you're able to give me appropriate answers, either in the beginning or in the management plan, somehow I'd have to prompt you. Doctor, will this affect my baby? Thankfully, ask me the questions, any concerns. At least that give me a sense of relief. At least you ask me that time. Don't you think that is important in fixing up before your agenda? Because you want to take the agenda as spina bifida. My agenda is whether my baby is affected. Unless and until you're going to answer my questions and make me feel happy, how can you think that you will be able to clear this task? Yes?
Yeah, you are very right, ma'am.
A person coming with hyperemesis and moral pregnancy, she has been investigated and she's coming to you to discuss her complainers, a bit of spotting. And vomiting since the past 4 days. She can't even drink a glass of juice or a glass of water. She's so tired and fatigued and burnt out, and she's exhausted. She's coming to you, and you are seeing her report is molar. Your agenda is molar. Her agenda is hyperemesis. If you talk on everything about molar, pregnancy, GTD, gestational trophoblastic diseases, regional centers, London, Dundee, Sheffield, and then follow-up 56 days, you will talk about the recurrence rates and the next pregnancy. But if you're not going to address that, I'm going to admit you, I'm going to start in IV fluids, I'm going to give you some medication for the vomiting. Your task is a failure, in spite of having talked in and out of molar pregnancy, because you never explored my concerns. My concerns was vomiting. I don't know what is molar pregnancy. I don't know anything in the reports. I don't know what is the importance of molar pregnancy and all this evacuation stuff, because you are traveling in your agenda of molar pregnancy, where you missed my agenda of vomiting. Always travel in the role plays agenda, my dear friend, to clear this task. Yeah.
Yes, ma'am.
So this is what I have said. Please open up your minds, open up your thought process, give space for the role play, allow her to question you, allow her to speak. Don't travel in your agenda. If you're going to travel in your agenda, you may not clear the task. Yeah? So give her space to active listening, explore her, and then she will lead you to success. Clear with this? And that is what the whole exam, my dear friends, is all about. The same old tasks they are going to ask you umpteen number of times, but still the candidates do fail. Why? This is what is happening. This is what is one of the things that's happening. I'm not telling the entire thing. This is what is one of the things happening. Unless and until your brains are going to get tuned to this methodology of practicing and learning at this point of your exam preparation, then it might be very, very difficult to achieve your goal. That is what we are here all about in training you people. Right. So coming to the feedback per se. Introduction, confirmation of purpose, agenda fixing. Before that, you have to explore her concerns and expectation. Start with an empathetic tone. Could you tell me more details of this condition? Were you able to walk with aids? How was the bladder, bowel, level of skin sensation, any foot ulcers? And I can see that you're coming at 16 weeks. So could you please tell me why was the delay? And could you tell me in which way I can help you today? And then could you tell me more details of your pregnancy? Please ask a combination of open and closed questions. Always throw open the questions. Could you tell me more details about the pregnancy? Could you tell me more details about the compliance? Could you tell me more details about the periods? That should be it. And if she's not saying anything that you want, you can ask closed questions then. So details of her pregnancy, about the folic acid. What this poor woman is going to know about contractures and folic acid, high dose. This poor little girl, she may not know. Isn't that just a jargon? Please avoid that, my friend. Also ask about folic acid or vitamin D, the periods and the smears, the regular history that your regular follow-up with the GP, apart from the spinal bifida, any of the surgeries, any clots, because she's sitting in the wheelchair, roll out clots, very important, allergies, blood group and RH typing, reservations for transfusion, very important question for any antenatal case, for any mental medical case. Surgical history, any details of that surgery that she had for the spinal bifida recovery, and please ask the permission to review the notes. Family list of any neural tube defects or clots, smoking, alcohol, drugs, and occupation, and BMI. Never ask double questions. Do you use smoke or do you use alcohol? No, please ask single question, because that might unnecessarily hamper your communication with the patient. BMI, mental health, social support, and try to summarize if possible. RCOG expects you to summarize. So if someone summarizes, that means you have actively listened to your patient, your role play. So your communication with the patient is good. You're a safe doctor by compiling whatever information that she has given, and you're able to reproduce that, and you're inviting for any other information. So you're a safe doctor. So RCOG expects you to summarize. Please do summarize. General physical examination in the presence of a chaperone, blood pressure and weight to height ratio, and tummy examination. Applied knowledge, it's it's a high risk pregnancy, so highlight that. Yes, folic acid, yes, any high risk, Nihal, diabetes, neurotic defects, any high risk for that matter. So at least up to 12 weeks, if it's going to be throughout the pregnancy, it's the best one, but at least up to 12 weeks. Here, 16 weeks, so it's, even if she has not started, you can start with it. But here, the role play told, the GP has given. Again, you're coming and telling the management option that I will give you 5 milligram folic acid. That shows that you didn't actively listen to the role play. Yeah. So it's a high risk pregnancy. She has to be consulted and the MDT, including your consultant, the doctor, the nerve doctor, the physiotherapist, the dietitian, yeah, and the sleep doctor, the anesthetist doctor, the baby doctor, the scan doctor, the fetal medicine specialist unit, and the geneticist. So all this is your MDT. And what about this? If she's 32, so why suddenly ask her that you want to? Have you thought about weight reduction? How can you imagine this poor little girl sitting in the wheelchair with a wasted legs to do any active exercises to reduce? Don't you think that might affect her? Instead, you can say that having an ideal weight, having a weight below a certain level, will help in the good progression of the pregnancy and a safe delivery. However, a couple of pounds, if someone is having a couple of pounds, we will be giving you appropriate management, appropriate advice to put in touch with a physiotherapist, and the dietitian is going to help you in preventing getting extra couple of pounds, as well as have a healthy weight gain throughout pregnancy. Right? And sort of saying that why you didn't think about losing weight, that might be very offending. Please don't say that. So she'll be on a shared care between the consultant unit and the midwifery unit, because she cannot all the time come to the clinic with a wheelchair. She has to depend on someone. So it's a shared care. Sometimes the midwife will visit her home. Sometimes, if needed, she will be coming to the hospital. And regarding the mother, she's less mobile. There's increased risk of clots. She has to hydrate herself well, do some physiotherapy, and if needed, she'll be assessed by the blood doctor regarding blood thinners. And she'll be getting into a bladder. Sometimes she might get into a lot of bugs in the urine. So as you correctly told that she needs antibiotics, but not continuously. She'll be assessed again. And because every time when she comes to you, she'll be assessing her urine test and look for bugs in the urine. And she can have some bladder accidents. She might have to use the rubber tubing. So don't say catheterization, catheter and all that stuff might be little challenging. They may not understand. So just use any rubber tubing to relieve yourself. Later on, she might have some breathing problems as the tummy becomes bigger. On the other hand, the baby may have got a 5 out of 100 chance of developing this spina bifida. So she'll be referred to the clinical geneticist, who will be able to assess her, and if needed, he'll be the one to recommend her to go to the fetal medicine unit, where she'll be taking some special scans. However, the scans are not 100% confirmative, because the special condition called a spina bifida occulta is not being diagnosed on the ultrasound that is being done, even if it's a high-end machine or in a fetal medicine unit, because that condition is generally diagnosed when the baby is born and 3 months after the baby is born by doing an MRI scan. So doing a fetal medicine specialist unit scan might not 100% prove that the child is not having the spina bifida. So that should be your answer for the question whether the baby is getting affected. Am I clear, Saishta?
Yes, ma'am, clear.
Yeah, the baby sometimes can grow small for the age, so she might need some additional scans. Sometimes the baby can try to come earlier, so it is for preterm labor. So she has to have some additional number of scans. And at 36 weeks, the anesthetist, the sleep doctor, will be there to to discuss the pain relief options and to discuss the labor plan. Early admission to the labor ward and vaginal birth can be offered to her. One-to-one support will be given to her. And postpartum, she can breastfeed the baby. She'll be having wheelchair-friendly prams and low baby changing tables. And as she's a BMI is 32, she'll be tested for any sugars by the glucose drinking test around 26 to 28 weeks. And she'll be given aspirin from 12 weeks onwards. Right. So to develop, reduce the risk of developing any clots in the legs and lungs. All right. Yeah. Sorry. For developing any preeclampsia, that is the high blood pressure and proteins in the urine. And yes, coming to postpartum, she can breastfeed the baby, and she'll be offered wheelchair-friendly prams and low baby changing tables. She'll be assessed for the risk of developing clots in the legs and lungs. By the blood doctor, if needed, they'll be starting her on the blood thinners, apart from the hydration and the exercises that she's being taught by the physiotherapist and the pet stockings. She'll be getting all the support from the hospital staff, the family, the friends, and she'll be offered suitable contraception of her choice, preferably a coil or a progesterone contraception. Better to avoid, combined oral contraception, which makes her into more risk of developing clots in the legs and lungs. Close with the patient information leaflet and support. Right? So any doubts so far? Shaista?
No, ma'am, very clear.
All right. So, yeah, tell me.
So, ma'am, I read we have to admit these patients. Means I think before 37 weeks, and
No. Don't worry about that. 36 weeks, she'll be called again for a meeting to discuss her delivery plan. And based upon that particular meeting, whatever the conclusions of the meeting, they'll be offered admission, or they can be sent home, or they'll be given appropriate guidance. Okay.
Right, ma'am.
36 weeks. At 36, all the high-risk patients will be called at 36 weeks to discuss the delivery care plan. Yeah. Right.
Yes, ma'am. Clear.
Yeah. So, any other doubts? Any doubts, my friends?
Ma'am, do we need to admit them earlier as they cannot feel the labor pains?
That's what I'm telling that. So she'll be always given her red flag signs, not now at 16 weeks. Maybe when she comes at 32 weeks or 36 weeks, you'll be given red flag signs, whether she has got some, she's having some discharge down below, some water gush, something is there, she'll be always called for. All right, so we'll be giving, so that's a totally different task, but you don't confuse it right now. This is just a 16-weeker.
I think,
And you
I
said
think,
that
of course,
initially, instead of saying that how you're coping with the situation, just we need to say that how are you doing today, right?
How are you doing today? So how do you feel?
How do you feel? Okay. Okay, thank you.
I think according to the level of the lesion, you will tell her, I will go back to your case note and see about the details.
Definitely, yes. Definitely.
Yes, if the lesion above T10, so she will need admission because she will not feel the liver pains.
Yeah, exactly. So that again, this is totally different task. So correlated the TOG and the materials you'll have to revise. Just not the spina bifida alone. The concerned TOG regarding the spinal injuries also you can revise.
Sorry, I need to ask why she is at risk. Why she is at risk to have diabetes because of the high body mass index only?
Sorry, Nidal, could you please repeat this?
Why she is at risk to have diabetes because of the high body mass index
32,
only?
32. Yeah, 32.
If they give me normal body mass index,
No need.
no need. Okay.
Because
Okay,
when
thank
we
you
did
very
the task, I didn't say 32. When we have done this task before, right?
Yes, actually, yes, we did.
Yeah.
But every time I'm learning something.
I gave her
new, really.
32. I gave to Shaista's 32, and that's why she told OGTT. Otherwise, no.
Thank you very much.
Yeah, thank you.
Excuse me,
Right.
Doctor, can I ask one question, please?
Please, Dr. Salma, please.
The folic acid should be continued throughout the pregnancy?
Not required. At least to 12 weeks. But here she is 16 weeks, and she has already started with folic acid as per her statement. So it's as good that it is not mandatory that she has to take till the end of pregnancy, but at least to 12 weeks.
Yeah, but in this case, we cannot say that to continue, isn't it?
You cannot, it's not mandatory to continue provided she's taken. Even if she's going to take now, that doesn't have anything to do because the organogenesis and everything is over by the first trimester. She's 16 weeks, so it may not serve the purpose.
Yeah. Thank you.
Thank you. All right. So any other doubts, my dear friends?
I just have one question.
Please.
Can I ask?
Yeah,
I
please.
want to know how much risk to the baby to be having spina bifida.
5
Because I
out
did
of
not,
10. 5, I told you, 5 out of 100.
5 out of 10.
5 out of 100.
5 out of 100. Yeah, right. Thank you.
Yeah, thank you. All right. So, any other questions? I'm happy to answer.
Sorry, ma'am, one question.
Yes, please.
Ma'am, we can diagnose only by scan, not any other test.
The geneticist and the fetal medicine unit are the one to decide on any further tests. So you're a middle grade doctor who will refer her to the concerned specialty, that is the clinical geneticist and the FMU, and along with the consultant, they're going to make a decision.
All right.
Right?
If this is, we can say if it is open, then we can detect on scan. Otherwise, it is not guaranteed. And
yes, generally, yeah. Even if it's a high-end resolution mission, if it's going to be an open type, they are going to say otherwise it's an occulta. They of course it's definitely not possible, isn't that? And again, it is cost effective. It's going to be cost effective. So NHS works on cost effective and economical policies, and you cannot bring in very big tests and say that I'm going to do this for you, do that for you, which is not exactly what's happening there. Yeah.
I was thinking about, ma'am, this alpha-fetoprotein, because this is also raised in case of neurotic defects.
Yeah, you can say.
Yes, ma'am.
Yeah, again, she's a 16-weeker, so that has to be also kept in mind. And again, you're going to send her for a Down syndrome also. She has not done her, it's the booking visit, so you're definitely going to send her for an amniocentesis. And all there, they're going to find out all these things. The quadruple test they're going to do for her.
Yeah, I just want to say here something, because this station come in the, I think, February exam.
Yeah,
the
it
role
comes
player
every
was
time.
asking,
It comes many times.
Yeah, the role player was asking, is there any other test to know that my baby is having this spina bifida? Maybe she want to know about the alpha-fetoprotein, because she already, my friend have this question. She already referred to fetal-maternal center for scan and for the needle test, anything she need. But she want to know, is there any other blood test? I think maybe she want to know about the alpha-fetoprotein.
See, what are the tests that you do in a quadruple test, my dear Tahira?
Sorry?
What are the tests that you're going in? What are the tests? Can you
Yeah,
tell me the test?
alpha-fetoprotein. I think
Alpha-fetoprotein?
alpha-fetoprotein, yeah.
HCG?
Just only alpha-fetoprotein. I think inhibin,
No. I'm asking.
Patient having.
No, listen to my question. She's 16-weeker. This is the first time that she's coming to you. So naturally, you have to do a Down syndrome screening. So you'll be able to do a quadruple test for the Downs. So there you're going to see the alpha-fetoprotein. So when you're going to say that you're going to do a Down screening, which includes a couple of tests, blood tests, so there comes the alpha-fetoprotein. And again, if the role player is going to ask you, yes, we can do this particular test called as alpha-fetoprotein, which is done as a part of your Down screening.
Yeah, because in the exam, the question, she was 20 week pregnant, not 16 week. Because time already passed for this, and she want to know any test. And we have no idea what test she want to know about that.
So it's because this woman she would have already had a dating scan and all that stuff. So everything is over. She's coming to 20 weeks. So if they are going to ask you if there are any special tests, yes, you can say that we are going to do some alpha-fetoprotein. However, she's going to repeat the same question. So whatever tests we do or whatever scans that we do now, there's this condition called spina bifida occulta, which may not be visible by even the special scans that we do now. So that will only be able to be seen once the baby is born and the baby is 3 months old, where we do a special scan called MRI scan to rule out that condition. So until then, she has to keep her fingers crossed, hoping that this baby is not a spina bifida. Yeah, so you have to say whatever test you're going to say. At the same time, you have to say the limitations of that, because you cannot give a false hope. So I'll do this test for you, and there's going to be 100% say that this is not this or this is not that. That's not that way, right? So you have to say the limitations, if at all, if any limitations is there or anything is out is that way, then you'll have to say that. Okay.
Yes. Thank you.
Thank you. So any other doubts, my dear friends?
Ma'am, for the downs, do we need to say both the quadruple test and the amniocentesis, or
No.
the only the quadruple?
Yeah, the quadruple test and then again the amniocentesis. If something is happening there, then the confirmatory test is going to be the amniocentesis.
Okay, okay.
Yeah. All right, great. So any queries for me today? Any queries you want to know from me? You're most welcome to communicate with me in smartnet.net@gmail.com or the Telegram. Right. So if there are no doubts, then we can close the session. So have a pleasant evening and good night. Thank you very much for joining the session. The link will be posted, the YouTube recording will be posted, the link will be posted. So keep practicing, and tomorrow I will be meeting you all at 12, not 12, 12:30, no, 4:30 GMT. Right, so that is 10 p.m. Indian time. We'll be meeting for a free smart hour. Okay, that's a free session tomorrow. You can join there, and that's just a 1-hour session over the call, and you can join. And there's no link for that. It's just a call, and you'll be attending the call. Thank you so much, and I wish you all the best. Thank you, and bye-bye. Have a pleasant evening and good night. Thank you.